Hi, Doc. Carl Rothschild here. How are you?
I'm good. How are you today?
I'm great. Thanks so much for taking this time. I just wanted you to first tell us your name and a little bit about yourself.
I'm Dr. Julie Howard. I have a practice in Plattsmouth, Nebraska. It's just outside of Omaha. I am a chiropractor and a nurse practitioner. I have the dual license in the state of Nebraska, which has made for an interesting practice, but it's worked well for our area.
That's great. And so, how did you get introduced to LipoMelt and a little bit about that?
I have a colleague and friend in Fremont, Nebraska, Dr. Kate Duncan, and she was telling me a little bit about it. So together, her and I talked to LipoMelt and decided to jump on board together, and we each bought one for our practice, and it's been awesome.
Awesome. Well, I like that word. It beats some of the alternative words. So in the world of awesome, a lot of times I like to ask two questions. How does it help your practice and how does it help your patients? So
Okay.
which would you like to answer first?
My practice is again odd because I do so many different things. It's helped my practice kind of focus a little bit on wellness to some patients and weight loss. You know, you can tell your patient till you're blue in the face, losing a little bit of extra that pudge will help, but until you give them a way to do that easily, or more easily, I should say, and in a way that they can see results fairly quickly, it's very difficult for them to take that jump to do it. So on some of my patients that I've been talking to for quite a while, this has been a great way to help them along. I have a couple of patients that have diabetes, and they're not out of control, but they're not in the best control. So they've been able to see the weight loss and the inches lost. Well, not, yeah, the inches lost pretty quickly, and that's helping them learn now to work on their diet and get a little more active. So it's really been a good confidence boost for them.
That's great. I was going to ask you, the LipoMelt works, we call it the trifecta. So it works with healing, it works
Mm-hmm.
with weight loss, and I don't know if you've seen, but very recently we've now seen how amazing results with the face and giving an actual facelift. Have you
Yes.
tried all three of these things?
We've tried more of the weight loss. We've got, I believe, two patients doing the face with it. Um, and I've actually used it on myself for the healing. As a chiropractor, my shoulders tend to be a little sore most of the time. So I went ahead and wrapped my own shoulders, and in less than the 20 minutes, I was able to function and work without the chronic pain that I have. So personally, that was amazing for me. Sadly, I haven't taken the time to use it as often on myself as I should, but I will get there. But I have a couple of patients that are loving the facelift aspect of it as well.
That's great. Um, let's see. So basically, you covered almost everything. One of the things I'd like to ask you is, did you guys do a test drive?
No, no, we just jumped right in.
Wow. Okay. That's great. I'm so glad for you. So what I was going to ask you is that if there were others, if there was another practitioner that was thinking of getting involved with LipoMelt, what might you say to them?
I would tell them just to do it. I was slightly hesitant in my area. The demographics isn't very wealthy. So I was kind of concerned that my patients wouldn't want to pay for it because it is cash. I don't send it through their insurance, and it's not, a cup of coffee. It is an investment. But some of the patients that I thought would never even question, think about it, jumped on board without a second of hesitation, and they're thrilled with it.
That's great.
So trust your gut. If you know it's going to help your patients, do it. It's all about the patients.
All right. Well, this was the shortest interview I've ever done because you just nailed it. Every question I asked was perfect. So,
Awesome.
and I don't mean it was perfect in the way that what I wanted you to say. It's just that you are very good at lasering in. As a practitioner, I'm sure you're dealing with patients. You have to kind of like laser in sometimes your communication.
Right.
Listen, I so much appreciate your helping us out and trying to get the message out to people because it is so new and people don't realize how, really it is effortless, healthy
Yeah.
weight loss. And I
Yeah.
love it too. And I have, now getting the feedback from a lot of people, and it's been sensational.
Yeah.
So like I said, if you get a chance to watch the videos that are on the
Will
website,
do.
I just want to thank you so much, and
You're welcome.
I'm sure I'll be talking to you again soon.
Sounds good. Thanks, Doc.
Thanks a lot. Take care.
You too. Have a good day.
Bye.
Bye.